By now, you've probably heard of the BRCA1 and BRCA2 gene. They're both part of a class of genes known as tumor suppressor genes. The acronyms stem from their full names, breast cancer susceptibility gene 1 and breast cancer susceptibility gene 2. In normal cells, these genes help stabilize the cell's DNA to prevent uncontrollable cell growth. The genes are very similar, but mutations in BRCA1 can lead to breast cancers that are harder to treat because they don't respond to the same hormone therapies used to treat tumors created from a BRCA2 mutation. Both genes in a mutated state can lead to breast cancer or ovarian cancer. The specialists at the Florida Hospital Waterman Digital Mammography Center explain when you should consider genetic testing for BRCA mutations.
It's a genetic DNA test that needs to be performed, and people who should get it done are people who have had at least 3 women family members who have had breast cancer at a young age, meaning like a mom, an aunt, a grandmother, all on the mom side, the woman's side, not the paternal side. That's the key. Then you can see, your physicians, and they can get appropriate genetic counseling. Because not only it affects breast cancer, there's a link between breast cancer and ovarian cancer. You have a higher incidence too, unfortunately.
We don't do BRCA testing for every single patient with breast cancer, but in patients who have a strong family predilection, if positive, increases your risk of developing breast cancer, and BRCA2 also with ovarian cancer. So for patients who are positive, we recommend that they then have usually a bilateral mastectomy with reconstruction, as well as a total abdominal hysterectomy and oophorectomy. That's why we're very careful to actually determine whether they are truly positive or not. And for patients who choose not to have an aggressive approach like that, we recommend close surveillance in the form of regular gynecological checkups, as well as tumor markers and MRI and other imaging of the breast to detect early cancers. I think it's very important to increase public awareness of breast cancer, how important it is to detect it early, which is reflective of better results and reducing mortality, and that's our aim.
Florida Hospital Waterman has been designated a breast imaging center of excellence by the American College of Radiology. If you'd like more information about the digital mammography services or to schedule an appointment, follow the BRCA Risk story link on our homepage at yourhometownhealth.com.